Hello and welcome to NCTV episode 57, which is about pain and inflammation on the undersurface of the foot, also known as plantar fasciitis. It's most often located close to the heel and it is caused by damage to the strong band of tissue called the plantar fascia, which runs from the heel under the arch of the foot to the base of the toes. The role of the plantar fascia is to support the arch, enabling the foot to work properly by spreading the weight evenly so that you can walk, run or stand without difficulty, making it effectively our shock absorbers. However, plantar fasciitis makes that job particularly difficult as it can be an extremely painful condition. It's most often worse just after you've been resting it for a while, and you may find that the pain improves when your foot is active, for example during exercise, but soon returns again after you stop. The risk factors for developing it are if you happen to be between 40 to 60 years old, do certain activities that put a lot of stress on the heel, like long distance running, ballet dancing or aerobic dance. Having flat feet and high arches, or being obese, or doing certain occupations where you're on your feet a lot and are on hard surfaces such as factory work or teaching. 10 common causes of plantar fasciitis may be 1. A sudden increase in the amount of activity you do. 2. Being on your feet for too long. 3. Exercising on hard surfaces. 4. Overstretching the sole of your foot. 5. Being overweight, as this increases the strain on the heel. 6. An injury or weakness in the ankle. 7. High or low arches. 8. Aging, as it's more common after 40. 9. Shoes that don't cushion or support the soles of your feet. And 10. Tightness in the calf. A few things to be aware of are that plantar fasciitis can increase the risk of lumps of calcium collecting in the heels called a bone spur, and this can make the pain worse. Weakness in the plantar fascia can also put additional strain on your ankle, knee, hip or back, so try not to overcompensate when possible. So on to the important bit, how can you treat it? Fortunately, there are some steps that you can take for self-help treatments for plantar fasciitis in the form of R.I.C.E, that's rest, ice, compression and elevation, which should start to heal the heel or the foot. So rest. By avoiding putting your weight on the heel whilst resting, it's also a good idea to do some gentle movements of it from time to time to stop it from getting stiff. Ice. Put an ice pack or frozen vegetables covered in a cloth or tea towel over the area for about 10 minutes every 2 to 3 hours. Compression. Wrap a bandage around the painful area. It should be tight enough to support it, but not so tight that it restricts the blood flow. And elevate your foot to reduce the swelling. When it's painful, rolling your foot over something like a can of Coke can be good for around about 20 minutes, and that should help. To get yourself moving again, gently massaging and stretching your calf, ankle and foot when you're resting can also help. Then it's a good idea to work on strengthening the leg muscles too, with certain exercises that the likes of an osteopath or physio could recommend. You can reduce the pressure on the bottom of your foot by replacing worn out footwear or wearing wide-fitting, comfortable shoes with a supportive sole and cushioned insole. Specifically ones that fasten with a lace or a strap and have a heel that's slightly raised about 2 or 3 centimetres, such as a good sports shoe. Some people have found that taping and night splints are also useful too. Try to avoid walking on hard surfaces with bare feet, wearing tight pointy shoes, high heels, backless slippers, flip-flops or flat shoes as well. If you're unsure what's best, you can ask your pharmacist about insoles, heel pads and other pain relief like paracetamol or ibuprofen. In terms of prognosis, bear in mind that plantar fasciitis can be a stubborn condition and it can take up to about 18 months to fully recover from it. However, if you feel these self-management tips have not helped after, say, 2 weeks, then it could be best to seek advice from your doctor, an osteopath, physiotherapist, or a podiatrist. Over the long term, try to follow a healthy diet. If you are overweight, research shows that reducing the strain on the plantar fascia by losing even a small amount of weight can improve your pain levels. If the problem persists after several months of conservative treatment, some other procedures that have been used to help the condition are steroid injections to reduce the pain, shockwave therapy and ultrasound to stimulate the healing process, and in rare cases, extreme cases as well, surgery. So that's today's bite-sized bit to help your health flourish, and I'll see you again next time. Bye-bye for now.